Has it been relatively smoother now than the initial rollout of vaccines?
Good morning, Dominic, and thank you for having me this morning. I would say the overall rollout is going well. There have been a couple of bumps, but overall in New Jersey, we vaccinated over 1,700,000 people already. Just at Hackensack Meridian, between our mega site and our hospital sites, we have vaccinated about 150,000 people. So, I want to put it all in perspective, because if you think about it, just a few months ago, there was no certainty that we were going to even get a vaccine this year. I mean, at the beginning of the pandemic, people were talking about years, not months, until a vaccine would be available. So the fact that we vaccinated this many people in a relatively short period of time, I think we're at about 65 million across the nation. I saw yesterday President Biden celebrated 50 million Americans being vaccinated just since he took office. So yes, there are some snags, and and I know people are frustrated because the demand is exceeding the supply. But I think it's getting a little bit better every day, and I'm still optimistic that we'll be able to vaccinate every American who wants one by the summer.
The Johnson & Johnson vaccine candidate right now, the idea here is if it does get approved, it could be a massive, massive game changer. 20 million doses in just the next couple of months here, 100 million through the summer. Is this a situation where the vaccine supply coming that large is going to get that many more people vaccinated? Is the system in place to administer all of those possibly hundreds of millions of vaccines?
I believe the system is in place. It's being upgraded each day, and I think you're right to term it a game changer. The Johnson & Johnson vaccine, if approved, and we're expecting it to be approved, over the next couple of days. If it's approved, it's a one-dose regimen, which really gives it a major advantage over the two-dose regimens there now. So we're hoping we can get into communities maybe that the other vaccines have not been able to get into. Also, if you think about it, in the hospital sites, a one-dose regimen could potentially vaccinate inpatients while they're there, and then they wouldn't have to make an appointment to come back. So this really could be a game changer. And the way I look at it, there's about 100 million doses that have been promised from Moderna by the summer, 100 million doses from Pfizer, and now 100 million from J&J. I mean, that's a great supply. So hopefully the systems, are being put in place. Certainly at our hospitals, at our mega site, we're ready. The pharmacies are gearing up throughout the nation. Some of the clinics, physicians' offices. So as I said, it's getting a little bit better each and every day.
So with the Johnson & Johnson vaccine, one of the big benefits, I guess, besides the single shot, is the storage capacity as well. If you look from a bigger macro global perspective, is the idea here that you can have a one-shot vaccine that doesn't need to be held in ultra low temperatures better for the overall globe, because you can go to places, underserved places, perhaps in Africa and Asia, that may not be able to have the infrastructure to get all those people vaccinated? That becomes a big deal as well, right?
It's a huge deal. That's a great point. From a global perspective, this vaccine really is a breakthrough, because particularly in underserved countries and even underserved areas within the United States, it's been difficult to distribute the ultra cold vaccines. So Johnson & Johnson just having to be stored in a normal refrigerator is a huge advantage in terms of access particularly for poorer countries.
I'm a lay person here, so I'm obviously not a medical professional. You're around them all the time here yourself, Robert. I've heard a lot of chatter just amongst my friends, my social circles, just kind of talking about the differences between, oh, I got the Pfizer-BioNTech vaccine. Oh, I got the Moderna vaccine. Johnson & Johnson's a new variable here as well. Is there any difference to them in terms of the efficacy? Is there any reason why people should be even talking about which vaccine they get?
I don't believe so. I mean, they're all very, very effective. I mean, we have to put this in perspective. So the Pfizer vaccine and the Moderna vaccine are about 95% effective. The J&J, the Johnson & Johnson vaccine, is a little bit less than that. But the flu vaccine on a given year is about 55% effective. I think last year's flu vaccine was 52% effective. So, in relative terms, these are very highly effective vaccines. And, I don't think whether you get the Pfizer, the Moderna, the J&J, there's that much difference. So I think people should be encouraged to get the vaccine for themselves, for their loved ones, for their colleagues at work. It's really, really important. And whether you get one or the other, you're gonna get the immunity that you're looking for.
Shepard Smith here. Thanks for watching CNBC on YouTube.